Minister of State, Health, Social Welfare, Dr. Tunji Alausa, today met with the U.S. Embassy to Nigeria, Mr. Greene, on how to collaborate with the U.S. government to provide better health care to Nigerians. My name is Comfort Olayinka. Welcome to Eko Hot Blog TV. The U.S. Ambassador to Nigeria, Ambassador Greene, with the Director representing President Biden Global Initiative for Malaria and TB in Africa, and other U.S. development partners paid a courtesy visit to the office of the Minister of State, Health and Social Welfare, Dr. Tunji Alausa, to discuss on how to better collaborate with Nigeria and the Ministry of Health.
In the development of the PEPFAR COP, our operation, don't underestimate the work that at least some of the state health commissioners have done over the years.
Handshake.
Oh, handshake, yeah. Are we looking at each other or are you?
In an exclusive interview with Eko Hot TV, Dr. Alausa shares plans of the Ministry of Health with the U.S. government, which includes digitalization of the healthcare system, energy audits, collaboration and sustainable finance, amongst others. Good morning, Honorable Minister.
Good morning. How are you, Comfort?
Fine, sir. It's nice to have you on our program. So for the record of our viewers, can you kindly introduce yourself?
I'm Dr. Tunji Alausa. I'm the Honorable Minister for State for Health and Social Welfare.
All right, so I would like to have an insight on the meeting we just had with the U.S. Ambassador to Nigeria, Mr. Greene.
Okay, good. We just finished the meeting with the U.S. Ambassador to Nigeria, Ambassador Greene, with a whole court of his people who work with him at the embassy. Part of the group included the Director of USAID, the Director of PEPFAR, Director of CDC, that all domiciled at the U.S. Embassy, and then also the a director representing the President Biden Global Initiative for Malaria and TB, as well as also a director representing the U.S. Department of Defense at the meeting this morning.
Okay, so give us an insight as to what the meeting is about.
Okay, the meeting is to discuss more on how we can collaborate with United States with the United States government and also our other development partners. Later this afternoon, we'll be having another meeting that would encompass all our development partners, but this morning meeting was limited to development partners that are from the U.S. As I said, CDC, Center for Disease Control, USAID, the Water Department of Defense, and then the representative of the President Biden Malaria and TB Initiative in Africa. And we talked more on how we can better coordinate. What happened in the last several years, almost over a decade now, these development partners are working in Nigeria. There's minimal coordination. Everybody's working in silos, and there's a huge amount of money, funds that they're bringing to our country being spent. But these funds, the coordination is very poor. So, and the core thing about this meeting was focused on 4 things. We discuss about digitalization, how we can digitalize our healthcare system, how the U.S. government and the various agencies of the U.S. government can help and support us with that. We have a clear idea of what we want to do here. We talk about energy audits for our federal tertiary hospitals, how they can help us collaborate with us in doing energy audits so that we can start using renewable energy for our hospital. Because this is becoming a crisis. And the third thing what we talked about was how to help, talking about collaboration in how to strengthen our healthcare system, and then and of course how to ensure sustainable financing in our healthcare system. It was a very good meeting, very interactive. They came with a lot of ideas. We also have us here at the Honorable Minister of State Office and our team. We also have a lot of ideas that we all discuss, and there are huge areas where we can collaborate here, and we're very excited after this meeting that there are a lot of things we can quickly work on. There are a lot of quick wins that we can work on and hit the ground running.
Okay, sir. So have you also looked into the financial implication of these things discussed?
No, actually, it's not. Obviously, we're a sovereign nation. Nigeria is well endowed. It's just that resources are not being managed the way we would want. But now we have the person of President Bola Tinubu who understands economics, who is and he's made promises over and over that he will fix this country, and he's been very deliberate and calculative on how he wants to do this. That's why he chose myself and Honorable Mr. Pate to lead the healthcare system, and he's given us all, and he's told us he will give us all the support that we want to fix Nigeria healthcare system. It's very unequivocal way that what we have now in our healthcare system, we're not where we want to be. With the bad indicators that we have one of the highest maternal mortality rate in the world, one of the highest infant mortality rate in the world, one of the highest under 5 mortality rate in the world. We have one of the highest stunting growth in the world, and also we have one of the highest zero immunization dose, kids that are not immunized. So we have plethora of problems. So, and the president has mandated us, we will fix this problem together with all the other issues and problems in the healthcare system. Now, we talked about the finances here. We're not beggars, we're endowed. We would work to improving our healthcare budget, healthcare allocation, the further healthcare allocation in our budget to the further allocation to the healthcare sector. But what we're talking more with them, the funds the development partners are bringing in, it's substantial. We want better coordination. That's key. If we're able to coordinate those funding with our allocation from the national budget, then we shouldn't be where we are today. But once we've got this, this is a huge part of our plan, we get the development partners to coordinate the way they're spending the funds they're bringing in, what we get from a federal allocation in terms of what's being allocated to the healthcare sector. We should be able to aggressively improve our bad indicators that we have and strengthen our healthcare system, improve our hospital, improve the care that President Bola Tinubu has promised Nigerians, the citizens of Nigeria. They deserve it. And that's what is mandated us to do. We're working on his behalf and working for him to serve, to get our citizens what they need.
Thank you very much, sir.
Okay.
Comfort Olayinka, Eko Hot TV.